Cardiovascular. So we just.
Doctor, give me the news. I got a bad case of loving you. No pills gonna cure my ill. I got a bad case of loving you.
My name is Lunga Lomnandi, and I will be teaching you how to wash your hands properly before examining a patient. It is very important to wash your hands before you touch a patient and after you touch the patient, so as to control the spread of diseases that are acquired in the hospital, which may be dangerous and resistant. Before I show you when to wash your hands, I will first show you how to wash your hands. So everyone takes okay, so we're going to start with palm to palm, and this must be done for 20 to 30 seconds, so you can time yourself. And then from there, back of the hand with your palm. You keep going. What you do on one hand, you need to do on the other hand as well. Then after this, back to the palms, but you interlink the fingers. Just like this. After that, you go to your thumbs. On both hands. After this step, we're going to do this. And then finally, with the final step. Now, it is very important to know the 5 moments of when to wash your hands. The first one is before touching the patient. Well, that is obvious, so that you don't spread the diseases to the patient. The second one is before a sterile or a clean procedure and before touching the equipment, so as to not contaminate the objects. The third one is after exposure to any bodily fluids. But with that one, you cannot use the alcohol solution. You need to wash your hands with soap and water. The fourth moment is after touching the patient. And then the fifth and final moment is after touching the surroundings of the patient. Thank you.
Oh, great, just in time. Hi, hello, how are you?
I'm good, thanks yourself, Doctor.
I'm doing great. You're Menzi, right?
Yeah, I'm Menzi.
Oh, welcome, Dr. Wiseman. Please take a seat for me.
Thank you, Doctor.
Okay. And now, Menzi, I think I've got everything I need for medical history. So now I'd like to perform a focused general examination on you. Is that okay with you?
Yeah, that's absolutely fine, Doctor.
Okay, great. Please sit on the bed for me.
Okay, no problem.
Sir, my hands are already washed. Now I'd like to start performing the general examination on you. Is that still okay with you?
Yeah, it's fine.
Okay, do you mind please putting your hands out for me?
Okay.
Okay, right, great. So first I'm going to check out your palms. They seem very dry to me, not sweaty. So I can draw out any signs of anxiety. And now I'm going to check at your arm. Looking at it from this distance, I don't see any paleness, so I can draw out anemia. Checking at your arms and palms again, I don't see any nicotine stains, which is normal of non-smokers, so I can guess you're a non-smoker.
Yeah, I don't smoke.
Okay, that's very good, sir. Checking at your tendons, I don't see any nodules on the tendons, so I can draw out tendons and matter. Now, sir, checking at the shape of your nails, they seem very normal to me, not spoon-shaped, not thin, so they were supplied with iron. You don't have iron deficiency. And now, I'm going to check for clubbing, so we can confirm clubbing in 2 tests. First, the Shamrock test, as well as rocking the nail pads. First, I'm going to ask you to perform the Shamrock test for me by putting together your fingers.
Any fingers?
Any fingers.
Oh, okay.
Great. So now, sir, I'm going to check clubbing, so we can confirm clubbing in 2 tests. First, the Shamrock test, as well as the rocking the nail pads. First, I'm going to ask you to perform the Shamrock test for me by putting together your fingers. Any fingers?
Any fingers?
Yes.
Okay.
Do you see the space between your fingers?
With space here?
Yes, this one. Do you see-
The diamond shape?
Yes.
Oh,
diamond
okay,
shape.
okay.
Is it visible in your fingers?
Yeah, I can see the diamond.
Okay, then
You
that's
can just
great.
check as well, Doctor.
Oh, there you go.
Oh, okay.
So we confirm clubbing by looking at that shape. If we have that shape, then you don't have clubbing.
Oh,
But
okay.
that shape has to be in every of your fingers.
Oh, okay.
Okay, now we're gonna rock the nail pads for me. I rock the nail pads for the sponginess, testing the sponginess. It's not moving in a way on the right or left, so we can also confirm that you don't have clubbing. Normally when you have clubbing, you have development of soft tissue in the distal part of your finger. So normally that diamond shaped ring that you see won't appear.
Oh, okay.
Okay, great.
Mm.
So now, sir, I'll be examining your face for any signs of jaundice, cyanosis, as well as anemia. Is that okay with you still?
That's fine.
Okay, first I'm going to check at your cheeks for color. I don't see any bluish tinge, so I can rule out cyanosis.
Mm.
Now I'm going to ask you to look up for me, please. I'm going to check your conjunctiva for anemia first. Your conjunctiva seems very pink to me. I don't see any paleness, so you don't have anemia at this point, sir.
Mm.
Then now I'm going to check into sclera. They seem very white to me. I don't see any yellow discoloration, so I can rule out jaundice.
Mm.
I'm going to ask you to please close your eyes for me. In your eyelids, I don't see any cholesterol deposits, so I can rule out xanthelasma.
Mm.
I'm going to please ask you to open your mouth for me and stick out the tongue, please. Looking at the lateral side of the tongue, I don't see any bluish color, so I can rule out central cyanosis.
Mm.
Even underneath the tongue, I don't see any bluish color.
Mm.
Then now checking into mucosa.
In the mouth, right?
In the
So
mouth,
open your mouth
yes,
again.
the sides
Okay.
lining your
Ah.
buccal mucosa lining your cheeks. I don't see any jaundice.
Mm.
Normally, if you have jaundice, there'll be yellow discoloration in your buccal mucosa.
Wow.
Okay, now checking the palate. It's not very high. It's in a normal position, and the teeth very white. Seems normal in color as well.
I brush my teeth every
Okay,
day.
great. Now I'm done with the ones there.
Okay.
So now I'm gonna ask you to swing your leg up for me.
On the bed?
Yes, on the
Okay.
back, because I need to check edema, and I'm gonna ask you to take out your shoes for me, sir, if you don't mind, please.
Must I leave my socks on? Must I take off my
No,
socks?
you can just lift them up. You don't have to take them off.
Okay, so put them here.
Okay.
Okay.
Yes. Okay. Now I'm gonna check for edema.
Mm.
Normally, how I check for edema is that I'm gonna make a pit using my 2 fingers for 4 seconds.
Mm.
If the pit stays there for 10 seconds, then you have edema.
Mm.
But if within 10 seconds it disappears, then you have edema.
Oh,
Okay,
okay.
should I begin?
Edema is swelling up, right?
It's swelling up.
But once you see it,
No, sometimes it's not visible.
Oh,
but you can
okay.
always feel.
oh, okay, sure,
Okay, great.
doctor, thank you.
So now, should I begin?
Yeah, sure.
Okay, I'm gonna start with your right foot. I'm gonna do this for 4 seconds. And I'm gonna leave it up for 10 seconds. Look, it's going already.
Mm.
That's so good. Let's try the other leg. 4 seconds. Leave it up for 10 seconds. Gone already. So you don't have edema.
I knew I didn't have edema, doctor. that is obvious, man.
No, I always have to make sure.
Oh, okay, thank you, doctor.
Okay, now say I'm gonna check at your pulse to see how well your heart is functioning. So now I'm gonna check at the radial pulse on both sides of your wrist.
Radial pulse is here?
Yes,
Oh,
radial
okay,
pulse is
yeah.
there.
I remember that from class the other day.
Oh, you learned it?
Yeah, we
okay, that's
learned it at
good.
school.
You know what I'm doing then.
Yeah.
Okay, first I'm gonna check it for 15 seconds, then I'm gonna times it by 4.
Mm.
So here, I'm just gonna check the rate and the rate.
Mm, okay.
Is that okay?
That's
Okay,
fine.
great. So we're gonna start now, looking at the clock for 15 seconds. So it's 20 beats in 15 seconds.
Mm.
That makes it 80 beats in a minute.
How do you
Yeah.
get that? 20 times 4.
Yes, it's 20 times
Oh,
4, and
okay.
that's 80 beats.
Oh,
per
okay,
minute.
okay, thanks.
So on your left side of the hand. So I'm gonna
Okay.
check even on this side now.
Okay.
Oh, still the same number of beats there. So still
Okay.
20 per 15 seconds.
Oh,
which
okay,
is
okay.
80 per minute.
Oh, okay.
So your pulse, the rate is normal between 60 and 100. If
Oh.
it was less than 60 or more than 100, then we would have a problem.
Mm.
And then even your rhythms there is very well. I don't feel any abnormalities.
Mm.
So I think your pulses are good and you're healthy. So
Okay.
keep on the good work.
That means my heart is beating properly.
Yes, just keep on
Okay.
exercising.
I exercise. I'm actually a professional soccer player.
Oh, that's great. sir.
Okay, yeah.
So sir, thank you so much for your time. I
Okay.
really appreciate it.
Thank you, doc.
Okay, now that your blood pressure is okay, I'll be making you on to the JVP. Is that okay?
That's fine.
Yes. Can you please take off your shirt and lie down, sir?
No problem, doctor.
So, before I take the JVP measurement, I have to make sure that my patient lies supine at an angle of 45 degrees, that he's exposed from the waist up, that I have adequate lighting, and that I'm standing on the right-hand side of my patient. Now for the JVP measurement. Firstly, I have to make out a pulsation in the region of my patient's internal jugular vein. Can you please look to your left, sir? Which is located between the sternal head and the clavicular head of the sternocleidomastoid muscle. You will observe a pulsation in this region. However, it is crucial to differentiate between a venous pulsation and an arterial pulsation. Firstly, you'll notice that they're both palpable pulsations. Sir, are you comfortable?
Yes.
Okay, now measuring the JVP. So firstly, I have to locate the region of his internal jugular vein. Can you please look to your left, sir? Which which is located between the sternal head and the clavicular head of the sternocleidomastoid muscle. I have observed the palpable region. However, it is very crucial to differentiate between a venous pulsation and an arterial pulsation. The first difference would be that, yes, they're both visible. However, the venous pulsation is non-palpable, whereas your arterial pulsation is palpable. The second difference would be that your venous pulsation is affected by position and respiration. For example, the JVP reduces with inspiration. And the last difference is that your venous pulsation has a complex waveform where you'd observe 2 pulsations to 3 pulsations at a time, whereas your arterial pulsation only has 1 waveform. Okay, so now I'll feel for the palpable region, and if it's non-palpable, I know that it's my venous pulsation. It's non-palpable. Okay. Now I'm going to mark the highest point of pulsation in order to measure his JVP. There. Okay. I will now use his sternal angle as reference point with my vertical measuring instrument, and I'm going to measure this in centimeters. So from his sternal notch, I have to locate his angle of Louis, and there, that's my point of 0. From there, I use my horizontal measuring instrument, and I have to place it perpendicular to my vertical measuring instrument from the point of highest palpable region. As you can see, his JVP measures up to 2.5 centimeters.
So doctor, what is JVP, and if it's 2.5, is that good?
Good question. So JVP is the measurement of the right column of blood, which extends into your right atrium and ultimately your right ventricle. So it's basically a measurement of the pressure that is exerted by the right hand side of your heart. Okay. So your JVP measured up to 2.5, which lies in the normal range, and I'm really glad to tell you that you're healthy. The normal range is between 2 to 3 centimeters.
Good morning, Tlabelo. My name is Minenhle Makase. I'm a first-year medical student, and today I'll be doing the first step of physical examination with you. Is that okay? Inspection is one of the first and most important parts of physical examination. It starts when the patient walks into the consultation room or when the patient is lying in the hospital bed and you encounter with the patient. Inspection starts when you look at the body as a whole and then you move into specific parts of the body. Firstly, I will look at his skin. Looking at his skin, he has no scars or any surgical lesions that might show that he had any surgical procedures done on him. And then I will look at his chest. His chest has to be a normal shaped and not funnel or barrel shaped. Looking at his chest, it's quite normal and it shows no barrel or funnel shaped. Therefore, my patient is fit to go to the next step of physical examination.
Good day, my name is Sesema Mhlongo and I'm a first year medical student.
Hello, Snetsemba.
Is it alright if I conduct an examination of your apex beat?
Yeah, sure, no problem.
The apex beat is the most lateral inferior point where the cardiac impulse is palpable with every systole. Inspection of the apex beat. I will now gaze over the apical area and look for visible pulsations. I can see it. Palpating the apex beat. I will now place my palm over the apical area. I can feel it. I will now use my fingertips to localize it and palpate the point of maximum impulse. The beat will gently lift my palpating fingers. I will now mark this area. Since I have marked it, I'll now map it out. I will first start by the sternal notch, then find the sternal angle, the second rib, which is in line with the sternal angle, second intercostal space, third rib, third intercostal space, fourth rib, fourth intercostal space, fifth rib, fifth intercostal space. This is in line with the mark I've made. Therefore, the apex beat is in the 5th intercostal space. I will now find the mid-clavicular line, which starts in the middle of the clavicle and extends right through the abdomen. The mark is about 1 centimeter middle to the mid-clavicular line. Therefore, the apex beat is in its normal position. It is not displaced. If it was displaced, it may be due to left ventricular hypertrophy. Are you still alright, sir?
Yes, I'm good.
Okay. I'll now palpate for heaves and throws. Palpating for heaves. I'll now place the heel of my hand on the left of the sternum. A heave is felt when the fingers are slightly lifted off the chest with every systole. This is a sign of right ventricular hypertrophy. Palpating for throws. Throws refers to palpable murmurs. I'll now place my palm over the pulmonary area and then the aortic area.
First things first, I have already washed my hands. Good morning, my name is Ngobile Mgomezulu. I'm a first year medical student.
Nice to meet you, Ngobile. I like your hair.
Oh, thank you. The position of the bed is at 45-degree angle. There is good lighting. The chest and the neck are clearly visible, and I'm standing on the right side of the bed. May I examine your chest, sir?
Yes.
I am doing the percussive step of the heart, which is actually taking the size of the heart by assessing the relative areas of enlargement around the heart. The area around the heart will be resonant because it's the lung area and it is air-filled. As soon as I approach the lateral border of the heart, the percussive note changes to downness. I'll start percussing from the 2nd intercostal space on the left side of the sternum and follow the mid-clavicular line until I reach the 4th and 5th intercostal spaces. Okay, this is the sternal notch, the sternal angle, the second...
So Ms. Mhlongo, I take it you're still comfortable?
Yes, doctor.
Okay, so with your permission, I'll be examining your precordium. Is that okay?
Yes.
Okay, so before we actually auscultate and examine this precordium, we just have to identify some key landmarks. So we're going to start with our sternal notch, and then we're going to go down, find our sternal angle. Across it on the right border of the sternum, we have our 2nd rib. Just beneath it, we have our 2nd intercostal space. So this area is called the aortic area. We're going to move across to our left-hand side in the 2nd intercostal space where we find our pulmonary area. Now, our last landmark is the mitral area, which is in the 4th intercostal space. So we're going to move down to the 3rd rib, 3rd intercostal space, 4th rib, 4th intercostal space in the mid-clavicular line. That's our mitral area. Okay, so heart sounds. When you're auscultating, it's important that I identify 2 heart sounds, S1 and S2. So S1 signifies the closure of the mitral and tricuspid valve, and it coincides with ventricular contraction or beginning of a systole, so when the heart begins to actually beat. We hear this best over the mitral area, so let's take a listen. So S1 is louder, lower, and a bit longer than S2. S2. So S2 is best heard in the aortic area. So we say the aortic area is in the 2nd intercostal space on the right-hand side. There we are. Let's take a listen. Okay. So S2 is shorter than S1, and it is higher pitched, and it signifies the end of a systole or ventricular relaxation.